what are your top 10 blood tests that someone's listening now and saying, okay, I've had a thyroid issue, or my doctor says my thyroid's fine and my TSH is sitting at 3.2, but where do I go? What do I do? What are the top, where must I educate myself with my blood test?
Steve, you're killing me here. So, because I started off by saying, mine is a very individual game.
Yeah.
I have a set of twins who will have similar thumbprints, and yet their bloods are completely different, right? And so it's very individualized because we've got patients from all over the world except South America, right? And they'll say, no, let me just do the test and then come and see you. It'll save me a trip. And I said, but it doesn't work that way. You know, because the list of blood tests is this long.
No, sure.
So individual. But I hear you. So in my mind, I say, let's go back to physiology.
Okay.
Let's take the studies and science out of it a bit. Because life's been around on this planet for 4.3 billion years. Okay? I've been around for 54. So the knowledge lies in that reservoir. So what is aging? Aging is a balance. Yes, genetics play a role, but it's a balance between free radicals and antioxidants. And it's the repair system. And so that must be important. So let's take a step back and say, well, what's my best reflection of my antioxidant state? It has to be homocysteine. So modern medicine has picked up on that, but they look at it at its extreme, that when the homocysteine is 80, this person's going to get a heart attack or stroke. And then the Framingham study says, well, if the homocysteine is 12.4, you're 4 times more likely. If it's over 9.1, you're 3 times more likely. If it's between 6 and 9, 2 times more likely. If it's below 6, the risk is gone. Well, what happens to be the reference range? 12.4. So we're willing to live with 3 times the risk.
I want to stop you there, Doc. Why don't medical doctors know this? Why isn't out there a simple test of homocysteine?
No, it's there. Framingham study's been known to everybody.
But the doctors aren't looking at homocysteine. They aren't measuring it. And even if it comes back at 9.8 or 10.5, they're not doing anything about it.
Yeah.
Where's the disconnect?
We need to go back and just look at our biochemistry textbooks. That's it. And it's all in the physiology. So you're asking me for my top 10. Homocysteine, because it speaks to what's happening between the free radical and the antioxidant state, right? Number 2, ultra-sensitive CRP. For me, that's not a fad like it's become now. I told you, from 2003, every one of our patients got it. So vitally important. For me, a measure of insulin resistance. I know the HOMA index is not a perfect one, but you cannot do a euglycemic clamp on every patient. You don't have 2 to 4 hours. It's too expensive. And if every metabolic clinical pharmaceutical trial is measuring it, so it's okay for them to measure it, give you the results, and you're happy to look at the results, but you can't use it in your practice. So for me, a measure of insulin resistance, either clinically or biochemically, vitally important. Why for every patient? Because the very gene that kept you alive, insulin, hyperinsulinemia, was protective when food was a scarcity, has come back and bit us in our ass now. That's why the prevalence of obesity and type 2 diabetes is so high. So for me, that is vitally important. Liver, very important. The liver speaks volumes in terms of what's happening. There must be a reason why your maker's given this organ a dual blood supply and no other organ has a dual blood supply. There must be. So vitally important for me. For me, the lipogram is important. Not for the reasons why you might think. The lipogram speaks volumes to me in terms of what's happening with the liver and what the patient's eating. Because sometimes the patient thinks they're eating healthy. But, food has been adulterated. So that speaks volumes in terms of what's happening. You spoke about magnesium. Not just serum magnesium. Red blood cell magnesium. Magnesium controls or has its finger in over 300 different chemical reactions. How can it not be important? You see, for me, I see a patient in ICU, pheochromocytoma, blood pressure through the roof, about to die. We're not winning. Infuse 4 grams of magnesium. That's a reset button. You're sitting with a patient with preeclampsia. Nothing's working out for this patient, about to deliver, put on 30 kilos in fluid over the last 3-4 days. Glucose through the roof, blood pressure through the roof, bleeding to death. 4 grams of magnesium sulfate and you reboot. And I can say the same about asthma, and I can say about status epilepticus. There is something more to this magnesium than we would. So for me, that is important. Of course, I'm an endocrinologist. Based on what they're going to tell me, the adrenal and thyroid, very important. And so you spoke about ferritin. Every one of our patients has a ferritin back from 2003. Now, I'm not getting the sick patient in ICU, right? So from a functional medicine perspective, that speaks volumes in terms of what's happening with the liver. Too much iron is no good in the system. Too little is no good in the system as well. So there's a few of these tests that are vitally important. They're low-hanging fruits, and I think they're very important. And let me end off by saying vitamin D. Now, there are problems with vitamin D and the way it's measured. But the problem then lies with our tests, not with that molecule. It's a pro-hormone. There must be a reason why most of endocrinology has their receptors with the DNA, whereas all the other multivitamins have their receptors sitting on the cell membrane. Why does this one have direct talk to the DNA? There must be important. So we've misnamed it a vitamin. It's a pro-hormone. It's a building block. And so just like plants rely on photosynthesis, we know vitamin D has its finger in 2/3 of the genome, 2/3 of the DNA. And I just spoke about its role in the immune system. And it goes beyond bone. So for me, the vitamin D is very important as well.